Welcome back, beautiful brave hearts. It is Lorraine here in Calgary, Alberta. I'm one of the DACA Detox master practitioners and trainers. I teach the pelvic restoration, and I am so excited to have Dr. Server with me today. And we are talking about ionic calcium therapy. And, this is a groundbreaking product, nutraceutical, and it is changing lives for sure. Today, his topic is fatigue. Dr. Server?
Hello, how are you, Lorraine? I hope everything's fine.
I am doing fabulous.
It's very good. It's a very good day. It's a very good day for talking about, I guess, fatigue, which is a very tiring area for us, but it will be very interesting to see with the different lens this disease. I can say that disease because fatigue is very hard even for healthcare professionals.
Exactly. Yeah, I know. Sometimes I'm burning the candle at both ends. And yeah, I need to make sure that I'm taking things like the Merigen.
Yeah, calcium is very important. And if it's okay with you, Lorraine, I would like to share my screen to talk about fatigue.
Yes. Yeah. So while he is getting that up there, um,
Can you see the screen?
yep.
Very good. Actually, I would love to see that it would be an important topic in the medical school in the naturopathic world because it looks very small topic, but when you dive in, you can see it's a huge area and it should take long time to learn for especially healthcare professionals, also for patient to see with the correct lens. Fatigue is very important because when you feel like I'm tired or not feeling comfortable, then we might think that it is not that important because I didn't have a good sleep, because I was working so hard. This is just closing the reason. This is not something that we want to see. We want to focus on the asymptomatic area, which means before disease, our body is giving us tons of information. Because of my field as a cellular health professional, as a molecular medicine doctor, I know that if we don't talk about the cell, then we will have a huge problem. So fatigue is a signal for us to understand what is going on. So also fatigue has a connection with calcium. So let's dive into fatigue.
Yeah, and like I said, I know when others, myself included, we're working different hours. Like we're putting in time at home, creating things so that you bravehearts have these slides and information coming to you. So definitely, we've got to take care of ourselves, and fatigue is a problem. We've got, our body is always giving us these signals, tapping our shoulder and say, hey, there's a problem here. Hey, there's a lack here. And that's what we're talking about is the lack that's happening and filling that gap with the nutraceutical that's going to do the job, right?
That's right. That's correct. And I also think healthcare professional as a teacher, we have to accept that as a good patient because when we go there, when we go to the clinic or when we are talking with the healthcare professional, we have to remember that we are here to learn something, not get our medication right away, not get something immediately. The thing is we have to learn from our healthcare professionals. So they know lots of things as a patient. So also sometimes we can be a patient, but we have to be careful because there is lots of myths are over there for fatigue or different disease. So let's focus on this area. What is the something that misconception that is problem? So I guess it is very good when we have coffee early in the morning. It's something good. I can understand. But we should know that it is not going to fix our fatigue. It is like closing your eyes for not seeing our problem. This is very important. We can have that coffee, but we should remember that it will come right away. It is not going to solve our problem when we get espresso or whatever we get as a coffee. So also we have to remember when we get different type of test or blood test, no matter what, result can be normal, but it doesn't mean that we are not in the process. That means maybe you came early to your healthcare professional, but still in the cellular level, we have an issue about losing our energy. So this is kind of signal for us about the disease, especially infections, immune disease, including cancer, neurodegenerative disease. We can make huge range for disease name. All of them are might start with the fatigue. So fatigue is another huge topic in this world. So we shouldn't think that, oh, it is because of poor sleep. So it is going to close just our eyes. So we should think why this is coming. I'm not tired. This is a signal of some disease. And sometimes we might think that exercise is good. I'm going to be very energetic, but we have to be careful. It has to be proper exercise and not always can be good. So we have to get a good advice. What type of exercise can be good for me? For example, if you are suffering from osteoporosis, some exercise are very dangerous. You can have fracture or different type of problems. So we have to have this proper exercise for fatigue.
Yes. Um, Yeah, and you're right about the lab results. The in the medical field, they're looking for disease, and your body is really good at making holding you upright and moving forward, even when you've got things like fatigue. And then you go to the doctors and say, "Hey, I'm really tired. I don't know what's going on." You do the labs, the blood work, and he says, "No, you're fine. You're fine." Because it hasn't gotten that deep. Your body's just doing a little tap, tap, tap. It's saying, hey, wake up. Really?
And yes, I guess we should say that not you are normal. Your test results are normal. It is not that. So we have to differentiate. That's the problem because we will look at the deep in cellular level for understand what is the problem. So let me change the slide. And I guess when we speak about fatigue, we have to understand how it is affecting our life. And this signal is why important because we have to say that fatigue is not the changing lifestyle. It is not about getting rest. If you do that, still you are going to have this fatigue. So we have to aware of disease, inflammation, and we have to think about our brain health, and also we have to think about our heart because this two area is very affected with the signals in our brain. If we think about calcium signaling, we can realize that without calcium signaling nothing is possible. Only with thinking something easy like what should I do about this situation? Not even thinking about 1 second. It is not possible without calcium. So calcium is in the center of all this signaling process. So if this signaling process has problem, then we are going to have a fatigue. So we are going to lose our energy. Also, we are going to lose our mood. Our mood will going to down, like feeling depressed. And this is also going to reduce our awareness. So we have to especially focus on our brain health with action potential, which means we have to think about our neuronal calcium signaling. It's not like something from the space, it is in our mind. And if we don't think that it is not important, then we will lose the awareness of this calcium signaling. So let's look at this fatigue deeply. And for looking this fatigue deeply, we have to know that it is very costly. If we don't think deeply about the fatigue, then we are going to face with autoimmune disease. I'm not quite sure, Lauren, do you usually see autoimmune disease? Because it is a very common disease, especially in the US, and I guess also in Canada, it's a common disease.
Yes, we see a lot of people with autoimmune diseases, you bet. And really, you're right. If we could have addressed this when we were feeling tired, it wouldn't have gone that far. Your body is so intelligent. When that signaling spark isn't there, you're going to go down. You're going to go down, and our minerals, especially the calcium, is needed for that communication.
That's for sure. And this low energy is causing gaining your weight. So this is a consequence which is very hard for us. And also it will cause pain. And another important thing is we have to be aware that brain fog is also over there waiting for lots of social problem, not just for us, also for our job. This brain fog and a low performance is because of the fatigue. So tiredness will also going to lower our motivation. So it is causing anxiety, depression, lots of dimension with the psychiatric area. So fatigue is coming because of the dysregulation of the calcium. For that reason, it is causing brain fog. It is causing lots of mood problem, lower motivation.
And a lot of people too would be using calcium as a supplement. And calcium as a supplement is not going to help because it's actually going to exacerbate the problem. We need to get something that's going to get deep into the cells, and that's what the calcium ion therapy does.
Yeah, I guess that's important to be a very smart patient. Being a patient, not something good, I know, but being a bad patient is far beyond that. So it's very important to understand our condition. It's very important to find good source about our life. So they might hear that calcium is good. Okay, give me, but this is not working with that way. We have to understand why I want this calcium and is this the right form of calcium? Is this the active form of calcium that is going to trigger our own hormones, trigger our regulation? We have to realize that. Also, it is same for fatigue. So as a teacher, if we want to help patients, we have to teach them they they need this energy. Also, as a patient, I need this energy for increase my health quality, life quality. So for fatigue, let's just think about our life. It's not, I know it's not that easy to go outside for 2 minutes, but still we can know that there is a possibility that can help us for our fatigue. So 2 minutes going out for taking the sunlight without sunglasses or window glass. So it would be very good for us to refresh ourselves, also to balance our hormone. Also, water consuming is so important. We might say that, yes, water is very important for me, but I have to see that bottle to say that, yes, you are taking your water. So you can measure that water. So not saying, but showing, yes, here is the water. And we have to also focus on constantly learning what can help us, not just medication, not just drugs, but for helping us only with the daily activity is very important, especially for fatigue.
Yeah, and you want to make sure that you are taking care of the body too. Another thing was the stretching, and I know that light stretching, just maybe a little bit of yoga, just before you go to bed, something very, very calming, or maybe even an Epsom salts bath, something like that. That's going to help with you.
Yeah, I guess when I look at animals like cat, they are very smart and they I don't know how they are doing, but with small stretching, they are just comforting themselves. I guess we can also mimic them. So stretching is also important. Looking our life is very important for outcomes. So this was another thing. Yeah. So let's come to the calcium signaling deeply. In the cell, we are looking at the endoplasmic reticulum. This is an organelle, and this organelle has connection with the powerhouse inside the cell. So why this is important? Because if we need energy, we have to see that mitochondria is working. So if mitochondria work properly, then we will produce ATP. And for producing ATP, we have to have a good calcium flow. If calcium is stuck in here, then we have several tiny molecule that producing energy in here. So if we have tons of calcium, which is unhealthy cell, then fatigue is over there. We have to remove this excessive amount of calcium from the mitochondria. Normally, ER is ready for taking this extra calcium, but they have a limit. So we have to remove this excessive calcium with active ionic calcium. If we get active ionic calcium, then it will trigger our hormone called calcitonin, which is removing calcium from here to bone. Because bone, poor bone, is ready for calcium. It is waiting for calcium. But if we don't give proper calcium, it will not going to receive this active ionic calcium and it will give its own calcium, which means we are going to face with osteoporosis. For that reason, every healthy individual by the age after 35 will going to face with osteoporosis because bone is the bank of calcium. That's for sure. So no matter when you need calcium, poor bone will going to give calcium. It will not gonna say no. So it will constantly lose its quality. So bone mineral density will go down. That means we are under the high risk of fracture. So let's fill this calcium with active form of ionic calcium.
Yeah. Um, when we are running in that sympathetic nervous system, we're running on histamine, cortisol, and adrenaline. And that histamine, cortisol, and adrenaline creates inflammation in the body. And we know that your body needs to have calcium to bring that, to buffer down that inflammation. And yes, it's going to grab it from the nearest bones or teeth. And that's why the normal person would have osteoporosis because you've been running, running, running in the sympathetic nervous system, which creates that inflammation. Your body automatically says there's a fire here. We got to put it out. We got to grab calcium from the bones or teeth, get that fire down. But you are still running in the sympathetic nervous system. We're not slowing down. We're 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 exasperating this problem, but we're unaware of it. because we're not taught that this is what's happening.
Yeah, that's right. I remember one research was about astronauts when they were in space. I know that they are getting very good meal, tons of calcium, very good exercise, and we know that they are very healthy with exercise program when they are in space. But after 3 months, up to 6 months, they get osteoporosis, which is very interesting for healthy individuals. They are running, they have very good time, but the thing is, they are not getting active ionic calcium and they don't have gravity. Gravity is very important. So having appropriate exercise is very important for our bone because we have sensitive gate in bones for taking calcium. They are sensitive to movement. So with that movement, they are opening their door. But if they don't have calcium, then bone will only going to lose its calcium. So let's say welcome to this calcium. We have to take that calcium to the bone, which is the exact correct place for storing bone, for storing calcium. And as you said, maybe when we have exercise, also, calcium is going to be very important for our muscles. And this calcium is not just going muscles, also going to neuron. So neurons are ready for triggering our muscles. So with contraction, these neurons is necessary. For exercise, neurons are necessary. And for giving this comments or for giving this order to contract, we need calcium. Calcium is going to open the door for this action, which is going to give a power to the muscles there is because this muscle is ready for action, but without ionic active calcium, we are not going to have any action in the muscles or also in the neuron. They have neurotransmitter transmission. So with calcium, we can see a maximum effect for contraction and also relaxation. So I guess this is also explaining how active ionic calcium is getting inside the cell. So yes, calcium is important, but if you are getting normal calcium with dairy product or with calcium supplement, which is not an active form of calcium, these are not going to come here as an active ionic form of calcium. So with AIC therapy, we are going to have appropriate calcium and it doesn't have to go to the small intestine. We don't need vitamin D for taking this calcium. And this is directly passing from stomach wall to the blood, which is active form of calcium. So when it comes to the outside the cell, we have lots of gate, which is ready and waiting for this lovely calcium, which is active ionic calcium. And these channels are only sensitive to calcium, which should have polarity. So this calcium will get inside the cell. And with this active form of calcium, when we take inside the cell, then it is going to be helpful for us. And why it is affecting our body? Because our body has lots of detection mechanism for calcium. So if it's high, if it's low, not just huge change, even small change is going to trigger this detection. And then our body will say, okay, calcium is here and we have high level of calcium. I have to take this calcium from inside the cell to outside, and then it will go to the bone. Lorraine?
Yeah, yeah. And And with the calcium ion therapy, what it does is it grabs onto the displaced calcium, from what I understand, and brings it back to the bones or teeth. Or maybe that's the body that does it.
Yeah, actually, body does it, but ionic calcium is the trigger mechanism. It is telling that you have this problem and then you have to take this calcium. We know that lots of patients is suffering from calcific tendinitis, kidney stone, gallbladder stone. So they have tons of calcium. Problem is not calcium deficiency. Problem is not the right form of calcium that we have. So what we have to do is we have to remove that kidney stone calcification. Also, these calcifications are very visible. Even with the X-ray, we can see that kidney stone. So the worst problem is inside this little cell, we also have excessive amount of calcium, which is cellular calcification. It is not visible until certain level. So in this time, if we have cellular calcification, we might not have a disease clearly, but we might have fatigue. We might have different type of symptoms that giving us a signal you have to be careful. So what we do is basically we are decalcifying this cellular calcium, which means we are cleaning up all this calcium from inside the cell to the bone, which is that much easy. And we are also correcting the calcium level in all area.
Yeah. And again, when you're in that sympathetic nervous system, that fight or flight, and your body is pulling calcium from the bones or teeth, it is creating crystallization in the tissues. And that's what we're talking about here. It's crystallization. So there's calcification happening, like you said, on the cells. And then when you look at it as a mass, now you've got crystallization. And then you keep running in that fight or flight, and you get calcification, which means now it's a mass. It's more than just little bits. And then it goes even bigger to scar tissue. So you can have scar tissue in your body without having an actual scar, because you've created that calcification buildup right there. And that would be your tumors, your fibroids, your lumps and bumps in the body, the aches and pains, the osteoporosis, rheumatoid arthritis, all those things.
Yeah. And when we talk about inside the cell, I don't want our patients to think that, okay, it's not about me. They are talking about cells. No, it is the center of the disease. We have to know, do you have diabetes? So you have problem in your cells. So we have to focus on that cells. Also for degenerative arthritis, also for osteoporosis or different type of autoimmune disease. Also infections, especially problems are coming from calcium dysregulation and mitochondrial problems. So with the mitochondrial problem, we are going to open huge door, which is causing tons of disease from the neurons, from the degenerative area, also even coming to the cancer. We have to realize how it is affecting our life. And fatigue has quite good connection with the mitochondria because mitochondria is the good ATP producer. So as we said, if we are not producing enough ATP, then we are going to lose all our energy. So if we make empty that mitochondria with excessive calcium, then our body will work for produce ATP for more energy for removing this fatigue. So AIC is just affecting our hormones. We have two hormones. Name is not that important. but for to understand mechanism, one is calcitonin, one is parathyroid hormone. Even with the small change of the calcium, these hormones are going to have a problem. So if we give AIC therapy, if we give calcium ion therapy, we are going to touch that hormone. With touching that calcitonin hormone, we are going to reduce the excessive calcium level in unwanted area, and then we will remove that to the bone, which is the solution for all this problem. And I guess when we think about calcium, we can say that when we balance calcium, then we will solve tons of problem. So restoring this calcium level in the normal homeostasis line, just like a normal level, we can now talk about how can we treat patient, how can we work with the patient if they have fatigue. But when we say if they have fatigue, then there is a wide range of disease, including multiple myeloma, including all type of arthritis. So how this is going to affect, we can see with the case, we can see with the real life how it can be affecting your patient. Lorraine, I guess also it is affecting especially older age, but nowadays maybe you are also seeing with the very young age, they are coming with fatigue.
Yes, coming with fatigue and growing issues. You know, we've had a number of children being put on the Oslo Junior or taking a smaller dose of the Marigen, depending on their weight. Um, and their bones just start to grow properly. It's like it woke up something in the body that wasn't performing quite right. And it is started with fatigue. Those little people aren't sleeping like they used to. And of course, we're showing our children how to do life. And if I am running in my sympathetic nervous system, go, 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 we teach that to our children. They're watching us. And yes, they are falling to the same symptoms that we're having, that lack of proper calcium that's going to help them even grow better and help them with their, you know, everyday life.
Yeah, that's right. I guess for kids, it's another huge problem. And they don't have any exercise. They don't do that. So that's also a problem for adolescents and teenager. I guess that's a problem. So let's look at the real life case, how it is affecting. Let's talk about the calcium signaling's effect on this patient. It's 40. This patient was 42 years old. Lisa was having degenerative arthritis, which is very common. So patient was not feeling very energetic, which is understandable because of the pain. It is not easy to have exercise, and patient was not able to, of course, play golf. So from the beginning, she wasn't willing to have this therapy because if they don't know, it's understandable for patient to feel what is going to happen. But we have to remember that this is active ionic calcium. This is not drug. This is not medication. There is no side effect. There is no health risk. So we can comfortably start to AIC therapy, calcium ion therapy. So patient decided to use AIC therapy with 3 times a day. And after starting AIC therapy, immediately patient realized that life is getting better. So patient was feeling that energy and vitality was getting better. So day by day, patient's outcome was getting better. And at the end, patient within 5 months, I guess, patient was recommending this calcium ion therapy to her husband. I guess it should be a good reference for her husband because seeing result is very important. I saw lots of healthcare professional who is using calcium ion therapy for themselves. Some of them for maintenance, some of them for their disease because they know it's effective. So after using for themselves, I guess it is making them much more comfortable. This is very powerful, and then they can see the results.
Yeah, we've had I've had people call me after they've started with the ion therapy and say, "Oh my gosh, I had no idea how good I could feel." When the body is full of displaced calcium, we don't move very well. Yeah, right, like the muscles are sore, the bones are sore, um, the brain is getting foggy. Like all of these things count, and calcium is so needed in the body, but not the calcium that you would get from your local health food store. No.
That's right. That's an not an active form of calcium, so only you will increase kidney stone or gallbladder stone, which is full calcification. So let's look at different case. Lyme disease, I guess this is one of the huge problem, especially for fatigue. Michael was 11 years old, so it is also a problem for adult patient. Lyme disease is chronic disease also. A patient was infected with Lyme disease, so this fatigue was also coming with the fever and migraine, muscle aches. So I guess it should be very hard. They tried lots of different treatment, including antibiotic, painkiller, and it's understandable. They want to find the solution how it can affect this patient. So they end with the calcium ion therapy 3 times a day. After taking only 40 days, patients all symptoms was disappeared. I guess it can show how it is powerful even with the Lyme disease because I know that they can have myocarditis, they can have different systemic effect because Lyme name is very short, but it's very heart disease. It's affecting all over our body, so we have to be careful with this Lyme disease.
Yeah, yeah, for sure, for sure. And the body hasn't forgotten how to heal. The problem is we don't know what the body is calling for. We're uneducated on the things that are required to make the body function properly, to help the body function properly. And this is an amazing discovery. Really, it is changing lives. It's saving lives. That's what it's doing. You're
That's
getting quality of life back.
Yeah, I guess for understanding our body, I think also calcium signaling should be a lesson in for healthcare professional because it's a huge area. Just like different topics, it should be a main topic for understanding, for giving us an information as a healthcare professional, as a doctor. So this is another patient who was suffering from multiple myeloma. 80 years old, this patient was having different type of symptoms, kidney issues, anemia, also uh, immune issues, and osteoporosis. So and fatigue. So also age is very important with elder patient. I think we have to remember it is making case much more harder. So for this patient, we start to use AIC, calcium ion therapy. When we start calcium ion therapy, we knew that it will also going to affect kidney because this type of patients are also suffering from kidney failure. So GFR, the level of GFR should be problem. Also, level of the blood should be a problem. So all these problems was possible for this patient, and this patient was suffering from, we can see from red color, which means showing that blood problem is over there, and it is going to cause also fatigue. Because if our blood level is low, then that's perfectly normal to see fatigue. And for this multiple myeloma patient, when we start to use, of course, from the beginning, patient was having this fatigue, but after using this treatment, we saw that all blood levels were coming to the normal range, which is also necessary for us. So including this white blood and also thrombocyte and all different type of blood cells were coming to the normal range. And also we have to remember this type of patients are also suffering from fracture because they are losing their bone quality. So with losing this bone quality, they will suffer from osteoporosis, which is showing in here. So we also have to solve this osteoporosis. So after using calcium ion therapy, bone quality was getting better and better for this patient immediately. And I guess not just multiple myeloma, for lots of oncologic patients, fatigue is huge problem because our body is trying to remove this disease. It is fighting for this disease with pH level, with immune reactions. So in that moment, it is perfectly understandable to have this fatigue. So if we remove the problem, then fatigue will go away. So that's the uh, result of the solving problem, Lorraine.
Yes, yeah. So when we can actually get people to understand what's going on and supply them with what the body needs, the body knows how to take care of it. It just happens. You can see that that T score came back to normal. Like, this, and that's in someone who's 80, so body hasn't forgotten.
Yep. Body is our teacher. If we give the proper lesson, if we give the correct tools, so we will see a result immediately. So active ionic calcium is that right tool. So our cells are ready for this active ionic calcium. And in this moment, calcium signaling should be not just thinking about disease symptom, it also should be thinking about the cognitive function because in our daily life, I know that we are making lots of decisions. So with correcting this calcium signaling, restoring this calcium signaling, we can increase our also cognitive function. It will be easy for us to make decision. It is not something miracle. It is about signaling in the neuron because that neurons are ready for getting correct signaling. So also, if you have any question, Lorraine, maybe they are asking question, I'm willing to answer, or we can also talk about fatigue that is affecting different type of disease. So it's up to you.
Yeah, just give me a minute here. I'll see if there's any questions that have come up.
And
Someone is saying, I used crushed eggshells.
Mhm.
I don't know how good that is. Um,
I guess I guess everybody would like to help themselves. It is perfectly understandable. But first thing, we have to learn what is necessary for us. So healthcare professionals are over there for that reason. We have to know what is going on. We have to understanding the root cause. So toxins, infections, genetic issues, these are the primary root cause that is bringing tons of disease. So if we remove that, then we are going to see the result with reducing the symptoms, and also we can see the outcome for using active ionic calcium with reducing these primary causes.
and then I've got Amy who has asked, where can you get this? And of course, you would go to the docofdetox.com and look into the store. And actually, you have to call in to get it. Yeah, you have to call the 855 number nine. So it's 855-900-4544 extension 0. And that will give you one of the master trained practitioners, and they will answer all of your questions about the ionic calcium and get you hooked up if that's what you want.
Yep. Thank you.
Yeah, so really there was only a couple of people that asked questions.
Yeah. So I want to say really thank you very much for this opportunity to talk about cellular health. And I know day by day it will be very important for patients to see cellular health is the most important thing, and the signaling is the another important dimension for our cells. Lorraine, thank you so
Yeah,
much.
thank you for helping explain everything for us in a way that we can understand. I really appreciate you showing up for all the brave hearts here. Thank you, Dr. Server.
It was my pleasure. I learned with you, so thank you so much. I hope you will have a very good day.
You bet. You bet.
Thank you. Bye bye.
Bye. Okay, there we go. All right. So we have our Healers of the Faith sales on still on until Sunday, and you can get up to 30% off. So there you go. Go to docofdetoxstore.com for more information on that. Let me see if I can share now. Share. There we go. There's the sale. And the next thing coming up here at the DACA Detox, we have Gold Care. And this is a BHN TV special world event with Dr. Dana Cranberg Nil and Dr. Simone Gold and Dr. Daryl Wolf and 18 world leading healers. This is on Sunday, July the 13th from 11 a.m. to 6 p.m. Eastern Standard Time. And then on Monday and on Tuesday, on Monday, July the 14th and Tuesday the 15th, we have Q&As. So you can hop in and get your questions answered. So on Monday the 14th, it's from 12 until 2. And on Tuesday, the 15th of July, it is from 7 p.m. till 10 p.m. You need to sign up for this. So go to BHN University and get yourself signed up. And other events that we have, June the 17th, Heal Yourself, Heal Your Family, and that is with Dr. Daryl Wolf. And then the Gold Care on the 13th of July, July the 5th, 19th, Rock with the Doc. And then August the 6th, Heal Yourself, Heal Your Family. September 6th, Rock with the Doc. October the 5th, Quantum Power Pack Healing. And then October 26th, we have Food Forest Abundance. And then we have in November the 13th, Super Soldier Immunity. And remember, we are growing exponentially right now, and our information, some of our information is starting to get blocked. So if you want to stay connected, you need to download that app. So you can go to bhnapp.com and get yourself onto the app where we are going to be putting, well, we are putting all of this information into the app. So you're going to have this information at your fingertips. So you're going to be able to free your, you're going to be able to get all the information right there. So there is the app, bhnapp.com. And on the app, you're going to be able to track your perfect day, the news and events, like I just said, New World Practitioner Map. You'll be able to find me there. Evolve is where you're going to find all of the libraries, so the world's largest free online library, videos, guides, audios for self-healing. You can connect with other Bravehearts all around the globe. If you are single and you want to find a Braveheart partner, you could go to the perfect match. Before you go and do the perfect match, you have to do the Braveheart Intelligence Masterclass, which is 33 days. Then we have the mindful moment chime. It's a little Tibetan bowl. You can set that chime for, reminding yourself to have your water, or maybe just calm your body, come back to your breathing. So go to bhnapp.com and unleash your roar. Dr. Sage is still on his tour. His next place is going to be in St. Louis, and he is offering the Wolf Non-Surgical Cell-Sonic Regeneration, cardio med bed therapy, thermography and consultations, and that is July 6th through to July the 15th. And you can call Tim at 479-215-9592. And then he's going to Los Angeles. He'll be there from July the 31st until August the 7th. Noreen is the contact there, the host. You can call her at 386-631-4066. And then we have him coming back up to Canada. He's going to be in Montreal, Quebec, and the beautiful Christiane is booking these appointments. He's going to be there from August the 23rd to September the 1st, and you're going to call 438-929-0997. And here are all of the places he's going to be doing his treatment and consultation tour. Take a screenshot if you need. And you can also get more information on the tour by going to bhnuniversity.com. And these are the courses that are coming up. So right now, just a couple of days from now, that we have the Wolf Non-Surgical starting here in Calgary, going until the 25th. And then right after that, we've got the Women's Pelvic Restoration and Disease Prevention starting on June 27th to June 29th. And then the next set of courses is in Ixtapa, starting with the Whole Life Coach Certified, October the 29th, and finishing with the Women's Pelvic Restoration on November the 23rd. And then he's going to be in Los Angeles in January, the middle of January, and with all of our courses, and then the end of January back in Ixtapa. And just know we have a brand new healing and training center opening up in St. Cloud, Florida, in coming in 2026. And of course, we have the one in Ixtapa, Zihuatanejo, where you can go from patient to hero and from victim to Braveheart. And these are all the places where you can find us on social media. So that's Facebook, X, Instagram, YouTube, Rumble, Telegram, BitChute. And that we are also Audible. So if you're like me and you like to plug in while you're driving or while you're out for a walk or exercising, these are the places you can find us. And just know we have fulfillment centers in United States, Canada, and Australia. And we ship worldwide. And if you love these products and you've started to talk to your friends and family and coworkers, why not be an affiliate partner? You can sign up as an affiliate partner. You can go to docofdetoxpartner.com and start earning commissions and referrals. We're also calling all health professionals and practitioners. Why not bring the DACA Detox products into your clinics? I mean, I know how great these products are, way beyond anything that I have ever tried. So definitely, if you're interested in becoming a DACA Detox wholesale buyer, you can sign up by calling the US Direct or WhatsApp number 1-469-861-9454 or the toll-free number 855-900-4544 extension 5, or you can email office.docadetox@gmail.com. And we have our Power Pack clinics worldwide. And when you purchase the Cellsonic and the Cardio Med Bed, we're going to give you 23 days of professional training. And that is going to make it so that you are going to have a great understanding of how these bodies work and how important the cell-sonic regeneration and the cardio med bed are to our health. So you can go to dodpowerpack.com for more information. And just know there is financing available now for anyone who is in the US, and that is for the DoD Power Pack. So if you require financing to get that cell sonic regeneration and that cardio med bed, it's available for you in the States. And it will also cover the training if you just wanted to go for the whole life certified or the Wolf non-surgical certified, or when you take the combined courses together, that's called the New World Practitioner. Um, This is the 5-star treatment and healing retreat in Ixtapa, Zihuatanejo. It's a beautiful place to go and visit. I stayed in Ixtapa for, well, right around 3 years. And you know what? I felt safe the whole time. I know it is a beautiful place. The locals are very, very willing to help if you're having difficulty with anything, and the majority of them do speak English. Um, but the DoD 5-star Healing and Training Center, this is where you can go and you can create your own retreat. So if you wanted to do a juice retreat or learn about the perfect day and you want the whole family on board on this, go and stay at the DoD 5-star Health and Healing Center. For personal certifications and training, Dr. Sage Wolf is willing to come to you, or you can come to us in Ixtapa, Zihuatanejo. You can call the toll-free number 1-855-900-4544, extension 5. And these are our prices for the courses. We brought our prices down when everybody was bringing them up. We want to get this information out to as many people as possible. So, find your brave heart and jump on board and educate yourself. And again, financing is available for even the courses for the people in US. If you're interested in getting a perfect day consultation with Dr. Daryl Wolf, I believe this has the wrong price. It should be $350, and that includes lifetime telephone support. you can call 1-855-900-4544 extension 1 and talk to Dr. Wolf's assistant about booking that personalized consultation with him. Or you can call on her direct WhatsApp number, which is 1-250-980-0554. And if you want a personalized consultation by a qualified New World practitioner, they're $150, and you can go to perfectdayconsultation.com. And just know we have our swag. We've got sweatshirts, we've got hoodies, we've got t-shirts, and we've got hats. So if you love the Doc Detox, how about showing it off? Get yourself some swag. The Ultimate Healing Guide, you can download it for free. You can go to pdgfree.com. This is over 550 pages of health information. This is Dr. Daryl Wolf's health information that he has accumulated over his 40 some years of practice. You know, this has a lot of, down to earth things that you can implement on your own. So if you want to start being healthy, you want to change your life, get the book. Either download it at pdgfree.com or you can purchase it from the docadetoxstore.com. And if you want to take all your power back, then reading the Healthy to 100, you can find that again at PDG Free. So you can download it for free or you can purchase it at the Doc Detox store. The only permanent healthcare is self-care, and the only permanent love is self-love. So we've got to come back to these beautiful bodies and start loving ourselves. If you want to rise to your full potential, you have to learn to fly, which means first love yourself. You cannot give what you do not have. Here at Braveheart Nation, we are stronger when we rise together, and we rise together because we are a group of people who want to see beautiful and healthy and we want to be able to support the earth, support the bodies, and really give the earth and the bodies what we need, what it needs. Go to bhnuniversity.com for more information about the courses. If you want to download the app, bhnapp.com. And we have come to the end, and we always like to end with the Braveheart Oath. So I'm going to put my hand on my heart. I'm going to slow down here a little bit, take a couple of slow breaths. I am love. I am healed. I am Braveheart. Today and every day, from the moment I rise until I gently close my eyes, I will always trust, honor, respect, protect, forgive, and totally love myself first and foremost before anyone else or anything else. So help me God, because I am, I can, I am love, I am healed, I am Braveheart, and I am all in. Thanks for joining us, Bravehearts. We'll see you in a couple of weeks with Dr. Server for another uh, more information on the ionic calcium.